Hello everybody, welcome to the second module of strategies for relieving stress. In today's session, we shall talk about autogenic relaxation training, the use of imagery in relaxation and progressive muscular relaxation techniques. We all so far we know that techniques of relaxation help us to calm down, and throughout these sessions I have been talking about relaxation as a very useful technique in relieving stress, or it is very helpful in anxiety disorders, and it is very helpful in anxiety disorders. So, today we are going to discuss about autogenic training, relaxation and imagery. So, to start with autogenic training, what exactly is autogenic relaxation training, or what is autogenic relaxation? Autogenic, the term as it suggests, comes from generating within oneself, or it comes from the word auto. So, it is a self-generating measure that one uses to relax himself, and this technique can be followed by the individual himself. So, once he is aware of the ways he can learn to relax, he can practice it within in the household or in office or any other place for by himself. It takes around 10 to 15 minutes to practice autogenic training, and it really helps to relax the individual's body as well as mind. Now, to start off with the history of autogenic training, in 1900 it was started with auto hypnosis when Oscar Vogt introduced the term auto hypnosis, where he tried to induce hypnotism within an individual by helping the individual to induce it by himself. Now, this helped Vogt used this with his patients, and he saw that patients with using auto hypnosis actually reported of less fatigue, less tension and fewer psychosomatic disorders. We know that the psychosomatic disorders are created due to stress and anxiety problems. So, psychosoma is actually the mind over the body. So, basically what happens in psychosomatic diseases is, or psychosomatic disorders is, that the anxiety plays a role in the manifestation of anxiety, manifestation in of stress or anxiety in different parts, bodily organs. So, the anxiety is manifested by different organs. So, it could be expressed as asthma, it could be expressed as headaches and other different forms of bodily reactions. So, when Vogt started practicing auto hypnosis in 1932, Schulz saw that his patients developed two physical sensations when they were practicing auto hypnosis, and they were primarily one of general bodily warmth and the other was of heaviness on the limbs and torso. So, from inspired by that, Johannes Heinrich Schulz and Wolfgang Luthe, one of his students, they started introduced the idea of autogenic training. Autogenic training, as I said, focuses primarily on the control of your body by yourself. So, it is primarily self-healing in nature, or in the nature of autogenics, and it is really effective for people with an internal locus of control. Now, we have talked about internal and external locus of control earlier. So, I will not get into that, just with a small briefing that individuals who feel that they are responsible for certain events that are happening in their environment, they generally, in brief, they generally have internal locus of control, and individuals who feel that they are not responsible, but the events and the circumstances surrounding them are actually responsible for the causal behavior patterns in them, generally have an external locus of control, or that the environment has a major influence over their behavior. So, now coming back to autogenic training, we see that what actually happens in autogenic training is there is a generalized warmth that is spread over due to the dilation of the blood vessels, and this results in increased blood flow. The sensation of heaviness is caused by muscle relaxing. So, as I was talking about Schul's patients who responded with in autogenic training, initially with auto-hypnotism, who responded with more of a heaviness in the limbs and the torso. So, this is the torso till here and the heaviness in the limbs. So, the arms as well as the legs, and because of the warmth, the sensation of warmthness, this was because of these primary physiological changes that the body was undergoing. Now, we will get to the next slide, which where we ask ourselves a question, then what is the difference between autogenic training and meditation? Now, we all know that meditation is another way to relax the individual, and here we are talking of autogenic training also having an influence on the mind and body. So, it is affecting the it is helping to relieve psychosomatic illnesses. Then how are the two techniques different? Now, meditation focuses primarily on the mind, while autogenic training focuses more on the bodily organs. So, it is said that meditation, when it is trying to relax, it is using the mind to relax the body, but autogenic training uses the bodily sensations of heaviness and warmth to first relax the body and then expand this relaxed state to the mind by the use of imagery. So, how are the techniques relaxing us? In autogenic training, the mind, first the body is relaxed, and then it is the relaxation is transferred as a feedback system to the mind, and here autogenic training uses imagery. So, let us get back to the benefits of using autogenic training. So, autogenic training has its physiological benefits as well as psychological benefits. So, some of the physiological benefits are, it decreases the heart rate, the respiratory rate, the muscle tension and serum cholesterol level. Excuse me. So, what exactly is happening over here? So, it is actually, if you see that this is actually affecting the sympathetic nervous system. So, the sympathetic activation that happens during a stressful situation, or that a body goes through during chronic stress, that is being reduced by the autogenic training, and the increase of alpha brain waves and blood flow to the arms and legs. Now, alpha brain waves are related to relaxation. So, if you do an EEG in an individual who is in a relaxed state, you will see that there are many alpha waves that are available in the response mechanism or in the EEG waves that you will see. So, this just indicates that when the body is relaxed, the mind also starts relaxing, or the brain also starts relaxing. And with autogenic training, as we were saying, that once the sympathetic activation cools down, then likewise there is a change in the brain activation also. Now, mind it, the relaxation in no way, whether it is meditation or it's autogenic training or any other form of relaxation, it does not mean that the alertness reduces. What happens is the individual is relaxed, but is also alert. On the contrary to hypervigilance, there is a sharpness and equity in attention that is seen with the use of relaxation techniques. Now, some of the other physiological benefits of autogenic training is, it helps to improve the immune function. This has been researched and it is seen that it helps to improve the immune function, and it has helped people with cancer. It improves the quality of life in MS or multiple sclerosis. It helps to decrease headaches. So, if there is a constant vasodilation and vasoconstriction of muscles that happens in tension headaches, that is decreased with autogenic training, and it also helps people with drug abuse. Some of the other findings are people who have a menstrual, girls and women who have a menstrual discomfort, it also helps in reducing that discomfort. So, the relaxation technique helps the muscles to calm down, muscles to relax. So, instead of the constriction of the muscles, once autogenic training helps to relax the muscles, and that way it also alleviates menstrual discomfort. Dyspnea is a form of a symptom that exhibits shortness of breath, or there is a distress in breathing, and this may not always have an organic respondent for that, but corresponding to it. But what happens is people suffering from it actually have a distress, and they breathe in as if with a lot of effort. So, it is like, so people with anxiety very often express this dyspnea. So, autogenic training helps in dyspnea, and it helps in the breathing patterns, in normalizing the breathing patterns. That is primarily when it is related to anxiety. It helps in sleep. So, we often see that in insomnic patients, anxiety patients suffer from insomnia or disturbances in sleep, and this is reduced by the help of autogenic training, and it also helps in relieving pain. So, these are the physiological benefits. Getting to the psychological benefits of autogenic training, it helps reduce anxiety, depression, tiredness, and increases the resistance to stress. So, what happens is when the musculature of the body, or the musculoskeletal system, is not responding to stress with sympathetic activation and immediate response, that feedback also goes to the brain that this is not so anxiety provoking a situation. So, the body is relaxed, so the brain will not be as tensed. And likewise, so we've spoken about Lazarus's cognitive appraisal. So, here the feedback from the body mechanisms is going to the brain, and the brain understands this is not so anxiety provoking a situation. So, likewise it improves the resistance to stress. So, an individual gets less stressed and less hyper vigilant and less muscle contractions during a stressful situation with autogenic training, after inducing autogenic training. So, it has been seen that it also improves the performance of athletes. So, what are the prerequisites of autogenic training? How do we know that autogenic training is actually helping an individual, or rather when do we know that autogenic training will help? So, what is required? So, a high amount of involvement and motivation is required for autogenic training. So, it is not like having a medicine that somebody has dispensed to you, and without even the appreciation of the context, one just gulps in the medicine just because my mother has told me, or my guardian has told me, or my doctor has told me. So, if there is an involvement and motivation, then autogenic training works. The reason being that this relaxation technique will be induced by the individual. So, it is not from outside. So, it is auto generated. So, there has to be a focus or self direction and self control. So, it is not like I will start this and I don't want to do this, let me leave. So, if a person is doing a task, doing autogenic training with such a motivation, then it is not going to work. Or if there is a lack of self control, that okay, I am just going to rush through it somehow, then it is not going to help. Ability to maintain a particular body posture. So, if an individual is not able to stay at a place for a longer time because of some musculoskeletal problem, or maybe because of some other problems of hyperactivity or muscular illnesses, so then autogenic training will not be helpful. So, it is important to maintain a particular body posture for a longer time. Now, another very important thing is to focus on minimizing the influence of the external stimuli, and focusing on the process of the autogenic training. So, I need to have the motivation to do the task, I need to have the self control to start the task and complete the task, I need to be focused about doing it, and of course, be able to maintain a particular body posture for quite some time, say around 15 minutes, and of course, be able to attend to the bodily sensations. So, if I am not being able to follow these postulates, then it will be a problem for me to continue with the autogenic training, or rather autogenic training is not going to be very helpful for me. So, now how to do the autogenic training? You will find various manuals available, and there are also several books that will actually tell you how to do the autogenic training for relaxation, but primarily we are going to discuss some of the things that I generally practice and some of the things that I have adopted from a few textbooks. Now, body posture is a very important thing for autogenic training. I was talking about it right now, and there are three basic positions for autogenic training. One is a reclining position where you are lying down in a relaxed way. The other two are seated positions. So, you can sit down like this with your arms on the armrest, and the other is where you do not have a backrest and you are sitting on a stool and you are sitting forward bent like this. Now, the idea is that you are in a relaxed state. So, it is not that you are distressing your muscles are contracting, and on that posture you are trying to do the autogenic training. Now, there are 6 stages of autogenic training. So, it starts with focusing on the sensations of heaviness throughout the arms and legs. So, you just close your eyes and then start focusing on each sense organ, or rather each muscle group. You start with the especially with the arm that is predominant. So, if you are a left hander, you could start with your left arm and then move on to your other arm, and then to your legs and to other parts of the body. So, it starts with the sensation of heaviness throughout the arms and legs, then the sensation of warmth throughout the arms and legs, and the sensation of warmth and heaviness in the area of the heart. So, it from the limbs it has spread to the chest, and then you focus on the slow calm breathing, then you focus on the strength of warmth in your abdomen and the coolness in the forehead. So, you see gradually your whole body is becoming relaxed. So, the other thing that we do when we are doing autogenic training primarily is focusing on particular sensational areas. So, we are initially focusing on, say, when I am saying your predominant arm, say your predominant arm is your left arm. So, it could be like my left arm is heavy, my left, then you say that for 4 times, then my right arm is heavy. Now, both my arms are heavy. Now, you have to feel this. So, but what I generally do is, when I am for autogenic training or for relaxation training, for progressive muscular relaxation, I have seen that this works very effectively with students when I make them sit in a place, focus on all the sounds that you can hear outside. Now, mind you, when you are trying to do a relaxation training, be it autogenic training, be it relaxation, be it meditation, be it a guided imagery, for any relaxation training, you have to have some time for yourself. You cannot start with rushing through the session. I have 15 minutes, at 16th minute I have to go somewhere. So, let me just wind this up. I am doing an exercise and I will wind it up and I will go for the class. That will not help. So, you need some time to calm down. Though the whole exercise is for around approximately 15 minutes, but it takes some time for the body to calm down and then move ahead with the exercise. So, what I see is very effective for the students is when I or even for others that I have seen, that you sit in a relaxed position, or even if you are lying down, you focus on all the sounds that you can hear outside. So, you have closed your eyes, you are you have loosened all the buttons, and if there is a watch, you have kept it aside, you have switched off your mobile. So, it should not go off suddenly and making you jump to see that, and you have kept it's primarily a quieter place where you are doing your relaxation, and there you are focusing on all the sounds that you can hear one by one. So, it could be right now I can hear the sound of the AC. Then what helps is if I close my eyes and focus on the sound, on the rhythm that is that it has. Many times when the fan is on, it also has a rhythm. So, thereafter we gradually, so this is not a part of the training, but this actually warms you up for the autogenic, for any relaxation training. Then as I said that it focuses on, so then you start with the exercise where you are focusing on first the limbs, where there is, you are seeing there is a heaviness. You start, if you are focusing on your left limb, so left arm, you see that your left arm is feeling heavy. So, my left arm is feeling heavy, I can feel the heaviness, and you say it to yourself for 4 times, then you move to the next arm, and that is the way it actually spreads from the arms and the legs. Then there is a sense of warmth that is spreading through the arms and legs, then warmth and heaviness in the chest, and this slow calm breathing, you are focusing on your breathing, and then to the warmth in the abdomen, and finally there is a relaxed forehead. So, this training is next followed by imagery. Now, imagery can also be used along with other techniques, like in relaxation, JPMR, progressive muscular relaxation, it also uses imagery. So, in today's session, I am going to discuss imagery separately, and you can try and link it up with autogenic training, you can link it up with relaxation technique, with guided imagery. Now, you will several manuals are available online, and you can also purchase some of them, and it is this I personally follow this, and I have got a very good response from the students, and it is really helpful to relax you. And the best part of the autogenic training is that it can be done within 15 minutes of time. So, now getting back to imagery, what exactly is imagery? So, imagery is actually imagining a scene or place or event that you remember as safe, peaceful, restful, beautiful and happy. So, one of the things that I have seen that works very effectively is imagining a natural scene, and especially a natural scene that does not have other individuals involved. So, you with nature, that really works well. One of the reasons I believe it is because the individual, when you are with another individual, the thoughts shift from the relaxing imagery to thoughts relating to the individual, and then as our thoughts jump from one to the other, we gradually move back to more anxiety provoking problems or situations that preoccupy our thoughts all the more. So, what is important is, that is why you being alone with nature. So, the imagery that you choose may be one that you have visited, one that you have liked, one that is very pleasurable, pleasant to you. It could also be that something that you have read of, or something that is fictitious, you are thinking about such a scene. It could be something like the sound of running water and birds, smell of cut grass, taste of your favorite ice cream, warmth of the sun. So, what is happening is, all these, as you can see, are actually addressing some of the sensations. So, the sound sensation, so then it is the smell, then it is the taste, and then it is the touch. So, basically we are trying to involve our sense organs into the relaxation process. One of the visual imageries that I generally work with my students, and which is very effective, is the image of the sea and you're walking down a sea beach with barefoot and on the soft sand, where you can see the hills far away, and it's around evening, and the birds are going back to their homes, and you can feel the soft salty breeze on your face. Occasionally the water from the waves are coming and touching your feet. You're walking on the soft sand. It is very pleasant. There's a pleasantness all around you. So for myself, this imagery works well, and I've seen this works well with students. But so you are with nature here, you are with the sea, you are with the sky, the red sky during dusk, you are with the mountains, and you can see the hills far away. So this is a very pleasant imagery for people who like the hills and the sea. Now if there is somebody who has hydrophobia or the fear of water, it will not work. Or if somebody has an unpleasant experience with the mountains or with the hills, now that is not going to work. So this imagery is not going to work for him either. So you have to, when you are selecting an imagery, it has to be something that's pleasant to you. But it is always advantageous if you select something that is more related to your personal experience, or to you, that's something you have read. If you are trying to practice it with somebody else, then you must ask the individual what his or her preference is, instead of just inducing him to your pleasant imagery. So some of the now coming to progressive muscular relaxation. Now progressive muscular relaxation is again to induce nerve muscle relaxation, and it was introduced by Edmund Jacobson. So several times we call the progressive muscular relaxation technique as Jacobson's progressive muscular relaxation, or we often call it as JPMR. So what happens in JPMR is that you are trying to relax each muscle group of your body. So the premise on which it is built is that the body responds to anxiety provoking thoughts and events in muscle tension. We all know that when there is an anxiety provoking situation, the muscles are tense. I gave you the example of you waiting throughout the day for the results of an exam. Imagine that when the exam results did not come out at the end of the day, you are still very tired. That's because of the muscles being taut and tightened due to the anxiety. So the relaxation procedure, the progressive muscular relaxation, actually wants to relax these muscle groups. Its focus is on relaxing these muscle groups and reducing the physiological tension, and in this way actually reducing the subjective anxiety. So when we are actually talking of anxiety, as I just mentioned, it is a accumulation of the physiological manifestations. So whether my muscles are taut, whether I have a dryness of mouth, whether I am having butterflies in my stomach, and all this, and how the individual is perceiving the situation. So also the thoughts related to the situation. So if it's like this, I cannot deal with this, so then the individual will be more stressed. So it's accumulation. Now if we reduce one of it, so if we reduce the muscular tension, like I was mentioning in autogenic training, this feedback is going to the brain. So I know this is very severe, this is really scary, I am standing in front of 1,000 people and I am speaking, oh God, I am going to faint. But what is happening to my body? My body is not responding like that. My body is pretty comfortable. I am not getting butterflies in my stomach, nor are my legs tremoring. Then that means this feedback is going to the brain, and then the brain says, this is not that anxiety provoking, so I can actually deal with the situation. So automatically your anxiety comes down. So basically that is what we are trying to do in progressive muscular relaxation. We are trying to bring down the cumulative anxiety by reducing the muscular anxiety or the muscular tension. So it is often, progressive muscular relaxation is often called neuromuscular relaxation for the same reasons as I said, that because the nerves control the muscular contractions, or also Jacobsonian relaxation or JPMR. So, some of the benefits in PMR or JPMR is the same as that of autogenic training. So, the physiological benefits being that it actually helps to smooth muscles, and it helps the relaxation of the gastrointestinal and cardiovascular system. So, anything which has been sympathetically activated, that sympathetic activation will be reduced, and it is helpful in treating headaches, backaches and side effects of cancer, primarily pain, and also is helpful for hypertension, that is high blood pressure, and disturbances in sleep or insomnia, or for that matter other sleep disorders also. Some of the psychological benefits, like autogenic training, it helps with depression, anxiety, post traumatic disorder, stress disorder. It and psychological, it helps in reducing psychological distress in heart failure, and it has also been seen to be helpful in improving the academic performance among college students. So, one of the reasons for that being that it helps to focus your attention. So, the moment your anxiety is reduced, you are able to focus more on stuff that you need to. So, how to do PMR? So, basically when you are doing progressive muscular relaxation, it generally addresses the 4 major muscle groups, that is arms, head, midsection and legs. So, these are the 4 major muscle groups that it addresses. So, the idea is to tighten each muscle group. So, feel the contraction, then release it, and you feel the relaxation as it spreads. So, what you are doing is feel the blood coming back to your fist. So, I am just giving you an example of tightening one muscle group, that is tightening of the fist, okay, and then relax. Now, this is followed with each part of the muscle group. So, it could start with this, then the other fist. So, you could start with right hand, then left hand, then you move up to these muscles, then tightening of the shoulders, and then the neck, the forehead. So, we have said that we address 4 muscle groups. So, now after we have covered the arms, the head, then midsection, so the back muscles, the chest muscles, and finally the leg muscles. So, what you are doing is you are actually focusing on the tightened state and then focusing on the relaxed state. So, in both ways you are learning to relax. So, there is a difference, you are understanding the difference between the contraction and the relaxation. Many times when we are watching a movie, or you are watching a cricket match, you are sitting like this without even realizing that these muscles are taut. So, when you are asked to relax, then you realize, oh, or you are told that okay, relax this, you are drooping down your shoulders. So, similarly in muscular relaxation, we are showing you, in muscular JPMR actually shows you the difference between the two, and this is, once the individual is trained to do muscular relaxation, he can actually practice this by himself. So, basically after the muscular relaxation techniques are followed, so for each muscle groups, it may be followed by a guided imagery. Generally for JPMR, it has to be guided by a trained professional initially at least. Then after the training is learned, then the individual can follow it by himself. So, one of the advantages of relaxation technique is that you can also, for progressive muscular relaxation, is you can actually focus on several muscle groups. Like you need not do it for all the muscle groups of the body, but if somebody has a headache, so he could focus more on the shoulder muscles, the neck muscles, the head muscles, along with some of the preliminary hand and arms and limbs. So, these are so primarily the head and midsection would get the focus at that. So, because of the tension headache. Now, this you can actually, a trained professional can actually help you to learn the relaxation techniques. In this, in today's session, we are not trying to make you learn the techniques in details, but what I am trying to do is I am actually giving you an overview of how these things can be done. But you can definitely follow it up with a professional, and you can also read up a lot on it. But to start off with, I will give you a tip today which you can start following. It's a very simple thing. You can sit in your in a relaxed position anywhere, take time out, take 15 to 20 minutes out for yourself, sit in a quiet place, loosen your buttons, there shouldn't be any tightness around you, and your mobile should be switched off. It's quiet, choose a quieter setting, just close your eyes, focus on the other sounds outside, as I was mentioning. So even the preliminary of a relaxation technique also helps you to relax. So basically in today's session, what we've after that, what you can do is, then after that gradually just focus on the each muscle group, and just that tell yourself that, well, this arm is relaxed, this my right arm is relaxed, my left arm is relaxed. So, and then focus on each area of your body. Then think about a separate imagery, something pleasant to you, and just try and lie down and relax, just be in that imagery for a while. Then gradually you can get back to the current state. Now, I am not telling this in details because I am not conducting a relaxation exercise here, but you could definitely try this. You could, I just gave you an overview in today's session. So, we spoke about autogenic training, we spoke about imagery, and we spoke about progressive muscular relaxation in very briefly, but I believe if you try and practice some of these techniques, or you get in touch with a professional, is really going to help if anybody is going through stress. Thank you.